right. All right. So again, hi everyone and welcome. We are now live streaming on LinkedIn, YouTube, and Twitter. And you're here for the MedTech Talent Accelerators Experience MedTech information session. All right. Can I get a thumbs up if you can see my slide deck in the emoticon? Okay, perfect. I got a bunch. That's great. So as my name is Adnan Syed, I'm the director for the MedTech Talent Accelerator, and I am from Toronto Metropolitan University. The MedTech Talent Accelerator is a partnership between the 5 universities you see below. What we'll do today is walk you through what the program is, what is the eligibility requirements for this next round that we're looking for talent for. And again, please, please keep your questions, and I promise I'll give you enough time to ask your questions freely once the presentation is done. So to start that, then I'll just want to start with a land acknowledgement. I'm here located in Toronto, or Takaranto, which is in the Dish with One Spoon territory. The Dish with One Spoon is a treaty between the Anishinaabe, Mississaugas, and the Haudenosaunee that bound them to share the territory and protect the land. Subsequent indigenous nations and peoples, Europeans, and all newcomers, like many of us, all of us here kind of fit in any one of these categories, have been invited into this treaty in the spirit of peace, friendship, and respect. So with that, I want to get into, what is the MedTech Talent Accelerator program? So in essence, we are a training program that is designed to launch the next generation of industry-ready, quote unquote, industry-ready talent for the Canadian medical technology sector. And you can see the partners we have, and a key partner that we have here, and I want to give a big shout out to, is MedTech Canada, which is the industry association for medical technology companies. So basically, the membership consists of medical technology companies across Canada, and it's a national organization that has them as members and also advocates on their behalf, and also just holds conferences. There is a conference coming up in October, I believe. So you could look at that if you're interested in that. So with that, I want to kind of now say, okay, so what is a sector when I talk about the medical technology sector, and how is it different from what you're all in? So for that, what I'll do is just a quick question that I want you to respond in the chat in the Zoom meeting that you're in here with me. In the chat, I just want to know what discipline you're in and what level of degree you're in. So if you could say, if you're a master's or a PhD or an undergrad, and give me the program name in the chat. And just want to see who all are in the audience. So thank you so much. So mechanical engineering, I'm seeing biomedical, chem-eng, biotechnology, biochemistry, experimental medicine. I have electrical and computer engineering. So thank you so much. Thank you for participating in sharing this. I really appreciate it. So what I want to say is, these terms that you've mentioned as your programs, like biomedical engineering or medical physics or biochemistry, what I call these and what we all call these is, these are disciplines. So it's a disciplinary knowledge that we are looking to build in you as talent. We do this at the undergraduate level as a bachelor's degree or a diploma. And then, as you become more specialized, you're doing a master's degree in this discipline or a PhD in this discipline. And you're specializing through the research work that you're doing, probably. So this is how post-secondary is structured. So the post-secondary is structured as disciplines. So if I look at the Toronto Metropolitan University, we're structured as faculties that are separated from each other on the basis of kind of discipline categories. So arts, business, as well as science, engineering, and others are there as well, community services and others. So but as soon as you step outside the door, after you're done your degree and then you look for a job and you're looking to, start your career or continue your career and build on it, what you're doing is you're actually looking for employment or building up a career, be it entrepreneurship or as a job. You're looking to do that in what I call an industry. And these are basically economic kind of groupings of kind of similar companies that are providing a product or service to a similar market or to a similar space. And there's and these companies have kind of collaborated and come together and clustered themselves in the economy as industries and sectors. So the one we're focused on here is the medical technology industry sector. And this essentially is, looking at what our kind of boundaries are of this in our program is really companies and organizations that are developing products or services. It could be hardware or software, it could be tissues, it could be cells, and looking at, them looking to apply that kind of product or service to the healthcare system. And that's really the category we're looking to focus on in our MedTech Talent Accelerator. So how does it fit? Our program is, I see that like primarily, and which is great, we've got the right audience. We are focused on graduate students as our program. And this is through our funding through NSERC, that we have an NSERC Create grant that this is through. So, and it is focused on master's and PhD students. And then, how does this fit? How are we doing this program? How are we running this program? And how does it align with your graduate program in terms of how you can participate with us? So what you see in the screen is this figure, which is in blue. You see the bubbles, but that's in essence the two programs we run. We run a program called Explore MedTech, and we run a program called Experience MedTech. And really what we're talking about today in our info session is Experience MedTech, but I'll give you a quick overview of Explore MedTech. So in essence, what we've done here is, what we want is, as you're doing your education degree, you become familiar with the medical technology sector. And the way we want you to become familiar is not through, me as an administrator at a university talking about the industry, but actually industry leaders themselves joining us for innovation seminars. We've been hosting these seminars since 2019. Every single one of them is recorded and on our YouTube as well as on our website. And we've invited a variety of industry leaders locally across Canada to actually share insights about what the medtech industry is about. So if you're thinking of, as you're finishing looking at your master's or PhD and, what you want to do next, and if you're thinking about industry, this is a good place to start, just to browse, go through our innovation seminars library, and watch some of the seminars that we've put together, and we'll be doing new ones starting September as well. And that's a good place to start to become familiar with, what is the jargon the leaders are using about the medtech industry, what are things they're talking about when they say innovation or strategy or paths to commercialization for such products or services. So that's one seminar series that we do, and we'll be running our next one. And from the fall and winter, we do about 10, it's about 4 to 5 each term. So you'll be seeing that through our website and through our LinkedIn page. If you aren't following us already, we primarily put things out through our LinkedIn page first. So if you want to know first what's happening through our program, please follow our LinkedIn page and have a good profile on LinkedIn. That's also very important. But that was a side note. So the next one that I want to just talk about for the Explore MedTech is what we call Hack MedTech or MedTech Hack. And in essence, what we do is we host one hackathon a year where we invite usually master's and PhD level participants from across our 5 universities to participate. And the challenge we get is usually from our industry partners. We work with 1 or 2 of them to identify innovation challenge they want you all to work on over a 3 to 4 week period virtually, and then we facilitate that hackathon. The last one we did was with our very good partner Myant, and it went really well. It was in last fall. So that's Explore MedTech, and really, I hope you all consider taking advantage of this. This whole piece about Explore MedTech is designed so that you can make an informed decision about whether you want to be pursuing a career in the medical technology sector here in Canada. So please do look at that. And then the Experience MedTech is really for yourselves as you're in your graduate program, when you're getting towards your final year and final semester of your master's or PhD degree. That's when Experience MedTech kicks in, and we'll talk about a whole bunch of eligibility and how that works in a minute. But in what you get out of this Experience MedTech program, our key effort is our online self-paced courses, which is really meant to make you more familiar with what the industry is about, how it's structured, how it's regulated, how do companies in the industry operate, and there are a few other topics that you will see in the next slide. So we do a set of online courses that we want you to take, as well as a job shadow is facilitated if you get an internship through us. So our key endpoint though is that internship. So we want you to do our training, and then we want to look to facilitate an internship between yourselves and one of our MedTech company partners. And we also facilitate wage subsidies and things like that for the partner, for them to be able to access you as a talent. And I want to be really upfront with you about, what this means for you if you try to pursue an internship through us, in terms of monetary, compensation. The minimum we set for any internship we facilitate is $10,000 for over a 4-month period, which turns out to be about $2,500 a month. So that's the bare minimum that any company that works through us would be possibly offering you if you're being selected to be interviewed and then being given an offer through our program. So that's what you can anticipate as the minimum. And then, we leave it up to the company if they want to top that with anything else based on their equity and policies and considerations they have internally. So I just want to be upfront about this, so we keep that very black and white in terms of what you can expect from our internship in order to make sure that, the hiring process goes smoothly between the intern and the company partners that we're working with. And usually this internship will take place as your final semester or just around your final semester of your master's or PhD program. Okay, so that's our program, and that's how it aligns. So the way you think of the MedTech Talent Accelerator then is, what we're called in, post-secondary terms is, we're a co-curricular program. So we aren't tied with your graduate program. Like you won't get anything, anything you do with us isn't going to contribute to, a credit towards your master's or PhD. It's not going to be doing that. It is like you going to the career center and taking, a resume workshop or a cold calling workshop or other workshops. We kind of sit in that category of activities for students. So just to give you an idea of what kind of a program we are. So this is just to showcase, some of the internships that we facilitated. The logos here show you the companies that have taken at least one, if not many, many more interns through us. And these are some example internship titles, intern position titles that we've actually facilitated internships for, just to kind of give you a flavor of what you can anticipate through us. And then I just want to give you again a little bit of an overview of the training. So, okay, what we call ourselves, we're getting you industry ready, quote unquote. So what does that mean? So we offer 4 badges. One badge is for you to get a better understanding of the business and commercialization side of MedTech. Another one is around research and development. Third one is really around, professional development, as an employee working in a company. What are some best practices in to be an employee and interact with your manager, supervisor, colleagues, and how do you manage projects, write emails that are effective, and things like that. And then our 4th badge is really, it was something that we actually just launched in the last year. This is unique. So what we saw is that, a lot of the science and engineering talent don't end up getting a lot of exposure to how our healthcare system works. And in essence, when you're in the medtech industry, you're developing products and services or managing them for delivering it within the healthcare system, be it in Canada or in other markets like the US or others. So what we wanted to do is give you a flavor of what the healthcare system structure looks like and approaches. We actually partnered up with Unity Health Toronto, where they've actually simulated some diagnosis and therapeutic activities, like physically pretending that there's a mannequin that has a heart condition and figuring out and showing you in a video how, you know, a healthcare practitioner team would go through to diagnose and then provide a therapy to that that patient, simulated patient, so that you see, you know, how is technology being used inside a healthcare setting. And then lastly, we also do have a virtual reality experience, or primarily what you will see it as is like a mouse and keyboard approach. We do have some VR goggles that can be used for this. But in essence, it's like a first person mouse and keyboard simulation, which you go in and you experience using an ultrasound and MRI and a few other rooms to show the deployment of technologies within the healthcare settings. So this earns you 4 badges through us, as we've indicated here. So this training is required for anybody who we facilitate. Anybody who comes into our program and is registered, we are requiring you to take these 4 badges as you prepare for being considered for any roles through our MedTech partners. So the next one is around eligibility. So here we're an open rolling program, so we're always taking in new talent towards our experienced MedTech program. But there are some considerations in terms of terms. So we've split up our program in these 3 different terms: fall, winter, and summer, spring, summer. And there's different eligibilities for, like, just the timeline for eligibility is what you're seeing on the screen here. So one, you know, you need to be, in order to participate at the moment in our MedTech Talent Accelerator program, you need to be an enrolled graduate student at TMU, McGill, or UCal's BME program, University of Calgary's BME program, Dalhousie's BME program, or UBC's BME program. And you need to be in the master's or PhD level enrolled in that. And then in terms of dates and timelines of your eligibility, for the one in September, you then should be, you know, be able to take on a full-time R&D internship with a medtech company for September, which means that you'll be done your coursework requirements and research, which has to be, it's a requirement that it's actually confirmed by your supervisor that you're in your writing phase and you no longer need to be in the lab doing experiments for your master's or PhD. That would be confirmed by your supervisor. There's a sign off required when you apply to us that you'll need to get your supervisor to sign, and that you would be open to taking then a full-time 4 or 8 month internship within these dates. So for September, then obviously it's from September to December, and then we have our next round, which is for January. So you're done all your stuff by December 31st, and you're ready to take on an internship in January. And then our 2023 May round is also open at the moment. So if you're going into your last year and you can predict that far, that you will be completing your work by April of 30th, you can apply to us for May 1st. We do give you an opportunity as you're enrolled in our program and taking our training, we give you an opportunity to change between these dates. So say at the moment you're predicting September 1st, but something happens where you don't see yourself being able to be ready for an internship through us in September, you can request to move yourself to the January round for 2023. And same thing here, if you're aiming for January, but something happens where you need to push it, there is a process, there's an opt-in process for our program that you get an email every 2 weeks from our platform indicating that, you know, opt in, that you're still interested in our program and you're still willing to be considered for internships through us. And in that email, in that form that you complete every 2 weeks, there is this possibility of transitioning between the timelines. So in terms of application or enrollment process, there is an application form And then in essence, once you apply to us, and our deadline for this round that we're really hoping to get the bulk of applications in by is July 30th, is what we want the application by. And then, we'd open up the training to you in August. And then the Experience MedTech internship will be based on, your start dates, availabilities, and our ability to engage industry partners to interview you and consider you for internships in their companies. I want to be very clear here, the training guaranteed, you apply to us and you're eligible, you will get the training from us. That is a commitment and guarantee from us. The internship is, we facilitate the internship hiring process. The decision to hire an intern is solely for the company. So the company decides who they want to hire. We make you all available to them in a fair way that they can evaluate all your applications for wanting to work in the MedTech industry, and then they decide who they want to interview. And then once they interview the selected candidates, they also determine who they want to hire as an intern. So how do you prepare? So given that you're eligible based on the previous slide, these are some tips and items that you need to prepare to actually complete your student application. So the first and foremost, please don't do anything before you go in and talk to your supervisor, tell them about our program. And then there's a PDF form that we've linked on our website and is in this deck as well. I'll drop the link to this deck in our chat, or Mary Susan, if you want to do that now, that's okay. And essentially, we want you to get the sign off and confirm with your supervisor. So you and your supervisor need to be on the same page about when you're looking to do this internship. Now, then after that, there's these 3 important things you need to prepare. One is your resume, which is the most key item in this process, because we put your resumes forward to our company partners to evaluate, to see if they want to consider you for an internship that they may have. So for that, I recommend, please, engage every single university that's a partner of ours has a career center, has career consultants that are fabulous. Please consult them in developing your resume and make sure it's crisp. By that, I mean, it's formatted really well. There's no typos. You've used the appropriate language to describe your quantitative, results of whatever roles you've taken on and accomplished, and things like that. So please, 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 please consult with your career center as you develop your resume. Take the time to do that. That'll be really important. We do review these. We don't just in a blanket way put it forward to our company partners. If we do see a resume that is not in an appropriate condition for us to present to our industry partners, we do reject applications. Or what we'll do actually is, first we will make a request for revision, and if that's not happening, then we would reject the application. Now, key thing, which is very different from in general what you do for resumes, that we need you to do with our resumes is, we want you to remove, not keep, remove your home address, email, and phone number, because we do circulate these resumes through our platform quite widely. We don't want to be presenting your personal information in that, in your resume or in any other way. We do have a process through which all companies can engage any of our candidates for interviews, and we present those interview requests and get your formal consent for each interview requested to determine whether you're interested in it or not. Once you say yes, that's when we connect you with the employer for an interview, to move the conversation forward for an internship. Okay, so please remove your personal home address, email, phone numbers, etc. As well as in terms of your city, you can just put down, Toronto, Ontario, if you're in the Toronto area, as an example. A key item to include, please, this is something I've gone from industry, that, they do look for project management knowledge and experience. So please do consider highlighting that, because, all of you are probably doing project management, because all of you are doing research projects for your theses and things like that. So so you do have that experience and you're building that experience. So please highlight it in that language in your resumes. And also, as industries do prefer, resumes over CVs. So I know, a number of your PhD candidates, you may be having, a significant number of publications and things like that, which can take, multiple pages at some points, or conference presentations and things like that. So with that, please, we don't want to see all of that. We need you to prepare a very clean 2-page resume, which is catered to the medtech industry, to say, why would you be a good candidate for consideration for the industry? What accomplishments you bring to the table for it. So that's for the resume. And then the next item, so that's the first item that you need to prepare properly. And then there's a pitch yourself item. So here, instead of the cover letter, what we've done is, and this is actually from feedback we got from industry, they want to see you write something. So that is focused on the career opportunity you're seeking. So what we've created is basically a pitch space, which is a 650 character space in which you write about why you're interested in working in the medtech industry. And that's a question that's going to be posed in the Google form, and you'll need to complete these 650 characters. So please, take your time to write this, and you'll probably, I would say, edit it. Don't try to do it on the fly before the deadline, but actually write it out, go through a couple of edits before you then put it in the Google form when you're submitting. And then the behavioral question. So this was also another request from our industry partners about, they essentially want to be able to do a bit of screening of the candidates before they request the interview. So here we've asked you to develop a 1-minute video. And it needs to be a raw video. We won't accept any, flashy edits and things like that. A plain background in which you respond to respond to the question of, you've been provided a task from a manager and you don't know how to do it. How do you deal with that? What would you do in that situation? So we want you to record a 1-minute video of that, 1 minute maximum. So each of these items, the resume, the pitch yourself, the 1-minute video, behavioral question, these are all reviewed by our administrative staff, and we will send it back to you if it doesn't meet our requirements. So it can't be a 3-minute video, it can't be a 2-minute video, it can't be a 1.5-minute video. It has to be a maximum of 1 minute in which you respond to this. And then our last item that we ask you to do, and this is, I want to be very clear in saying this, we absolutely do not share your transcript. We are asking you to submit your transcript to us. This is for us to verify your eligibility, that you've completed your courses, and that you're in that phase that you're telling us that you are in. So it's a verification piece around transcripts. We do not share these with anyone. Our administrative staff are the only one that will look at it for the fact, just to confirm eligibility, and that is it. And no one else has access to your transcript. And we don't present that to the employer in any capacity. We only present the 3 items we mentioned: a resume, a pitch yourself statement, as well as your video behavioral question, is what the employer gets to screen to determine whether they want to consider you for an internship or not. So with that, I think that covers, all that I wanted to kind of describe to you. Our website is talentaccelerator.com. You can go there and pick the MedTech Talent Accelerator. I do want to highlight that, please, again, our LinkedIn page is where we post everything first. So please go on and follow our LinkedIn page. And I also want to emphasize, as a side note, in this day and age, a very common thing to do is to search people on LinkedIn to see their profiles and what they're showing there. So consider it as your public resume. As you're improving your resume for us, please do consider working on your LinkedIn profile and make sure it's up to par with how you'd like to present yourself professionally to others. If you have any questions after our conversation today, we do have an email. You can email us at any time, medtech@talentaccelerator.com. So with that, I'd like to go ahead and thank you for joining this session. I will make time available now for questions, but before I do that, I will be turning off the recording as well as the live stream. So again, thank you so much.